Yeah, a very good afternoon to all the esteemed faculty. So I'll be talking for YAC-PA for all PACS. Um, so in primary angle closure suspect, there's more than 270-degree iridotrabecular contact with no signs of past closure and with a normal intraocular pressure and the normal optic nerve. So in this scenario, you may either want to go for observation with a regular follow-up, or you may want to do a PI. So I would prefer to do a YAC-PA in all my PACS as the global burden of glaucoma is overwhelmingly high. In India, glaucoma is a leading cause of irreversible blindness, with 1.2 million people blind due to it. And unfortunately, most cases of glaucoma remain undiagnosed in the community. And gonioscopy as a technique is not popular and it's not done by every ophthalmologist. Also, we know that PSCG is much more blinding in POG and has been seen in many the population surveys. Now, what is the risk of progression if you do not do a YAC-PI? Now, it has been seen in population-based study that over 5 years, 22% of PACS will convert to PSC and around 30% will convert to PSCG. Also, it has been seen that in a hospital-based study, after doing an LPI, no eye with PSCS progressed to PSC or PSCG. So if left untreated, what happens? We know that 65% of the rural population, is in India. We have 65% of the population in the rural areas. So any margin improvement in glaucoma care will have a vast effect on the decreasing vision loss and blindness. And because most of these people, they're residing in rural areas, so the follow-up will be quite, maybe quite poor. So the most prevalent, in one of the studies, it was seen that the most prevalent barriers to follow-up were belief that there was no problem with the one size and the lack of ascot. And as you know, the prevalence of angle closure is higher in females. The problems are magnified in women. In a busy clinic, in routine examination, we may be able to do a gonioscopy, but we may not be able to assess other risk factors that may lead to angle closure, like an increased lens wall, the interior position of the ciliary processes, and even the size of the pupil in mesopic condition, which may be quite high. Like in this patient who was like just 44-year-old, in mesopic condition, her pupillary diameter was around 6 millimeter. And also nowadays, like yoga is very predominantly done by many people, and it has been seen that yoga done in lying down position may increase the pupillary block and may predispose the size for angle closure glaucoma. Also, repeated dilatation may be required in patients of diabetes. And India is the second most affected in the world after China. 1 in 6 people in the world with diabetes is from India. So considering the huge amount of the diabetic population in India, I think PSCA, YAC-PA would really help in preventing the any kind of angle closure progression in this PSCS patients. Also, in young hypertrophic, there's progressive lens growth throughout life. So even if in the earlier part we may not do a PI, but later on they may require a PI with progression of angle closure. Also, what is the direct cost of treatment in acute glaucoma?
We can't hear you, Dr. Julie.
I think a technical glitch. Once her time is over, we'll start with the next presentation.
Yeah, I think we've lost her.
Yeah.
Yes. So I think we can move on to Dr. Devang for the YAC-PA not needed for most PACS.
Sorry, actually,
You're back, Julie. We thought we missed you.
Yeah.
You can quickly sum up.
Yeah. I'll just sum up. I'll just share my screen again. The cost of treatment is very high, like around 137% of the there was the total expenditure of travel, stay, loss of wages, and the cost of the AGMs was around 137% in the low income groups. Also, the medical legal issues, like if a patient of PACS we keep observation and the patient goes on to develop an angle closure, then taking medical legal issues also. Whereas the side effects of YAC-PA is very low. Like if the iridotomy is properly covered by the upper lid or it is completely exposed, then it has been seen that the visual symptoms of shadows, ghost images are quite less. So I'd like to conclude that laser PI has been found to be safe and effective, and the economic and the visual burden of PSCG is very high. So when you see a patient, it may be the only time that you may see him. And so I would like to do a YACPA normal PSCS patients. Thank you so much. And sorry for the inconvenience.
No problem.